single day, like I've always done and always will.
Passing these bills on the floor, making it another stand.
Welcome to this week's edition of New York Now. I'm Chantel Destra. This year, New York State released its first ever master plan for aging. The plan is meant to ensure that older New Yorkers can live a healthy life with dignity and peace. The comprehensive plan is rooted in 9 pillars and includes over 100 proposals for both the private and public sectors. The State Department of Health, along with the State Office for the Aging, led the charge of coordinating the master plan and were vital in its creation. To learn more about the plan, we sat down with James McDonald, who serves as the State Health Department Commissioner, as well as Greg Olsen, who serves as the Acting Director for the State Office for the Aging. Here's that conversation. Thank you both for joining me here today.
Thank you.
Yeah, thanks for having us.
Now, I'm so excited to dive into the state's master plan for aging. This year was the first year that the State Health Department, along with the State Office for Aging, unveiled the first ever master plan for aging New Yorkers. So can you tell us a little bit about what the plan entails and how it all came together?
So maybe I could start with that, and then Greg can fill in a little bit. But so really, this was made by New Yorkers, for New Yorkers, so we can age in place in New York. Like really, it was wonderful working with the State Office for Aging. You know, it was wonderful working with all the hospitals, local health departments, and hundreds of community-based organizations, really. Because really what this was about was like, it's your New York. How do you want to age in New York? And there's a real honest pragmatism to the Master Plan for Aging. You know, there's all these great little inputs here about all these possible proposals that we could see what New York would look like to make New York a welcoming place for us as we age here. I'm hoping to age here.
Well, I'm totally going to age here, and Commissioner's spot on. You know, I think putting some context behind this is really important. I really have to not only thank Commissioner McDonald, the Health Department, the State Office for Aging, Department of State, the agencies, and the 400 plus stakeholders, but you have to thank the governor, who really recognizes it's something we don't talk about, is the value of older adults, economically, socially, and intellectually. So, for example, 40% of all the taxes paid in New York, local and state, $72 billion, are from older adults. Their workforce contributions are $500 million, almost 50%. They're the largest volunteer group, largest entrepreneur group, largest givers to philanthropy and charity, large home ownership rates that are supporting local schools, Medicaid, local businesses, et cetera. So we want to keep their contributions not only within their families, but within their communities, because they're really an economic and social powerhouse. So got to give the governor for being one of the few governors in the country that really recognizes the why. Why are we doing this? Not just the how, not just the what, but the why. And it was a huge undertaking with the amount of state agencies that touch older adults and their families, the stakeholders, but I think what Commissioner said is exactly right. This is a plan by the people, for the people. We were charged with facilitating a process, which we did with lots of subgroups, over 800 meetings over the course of almost 2 years. But this is a plan that New Yorkers came up with to help them age as long as possible with dignity in the communities of their choice.
And it's my understanding that the plan is rooted in 9 pillars, and I imagine, you know, that requires some tough decision-making to be able to narrow it down. So can you tell us about, first, what the 9 pillars are and the process of narrowing down those pillars?
Yeah, so I think when you look at the 9 pillars, it's really about like just aligning certain strategic directions. Like one of the pillars, for example, is housing. Housing's an issue that's near and dear to everyone. You know, you need to have stable housing. But strategies like how do you make housing more affordable, but also practical things like, you know, very little housing in New York State is actually ready for people who are older, like has zero entry. Like in other words, if you have to keep walking upstairs to get into your house, that's something that's kind of interesting. Another little pragmatic tip is, you know, as you get older, when you're trying to open a door, you know, a doorknob that's circular, it's a little harder to move with your hand, whereas a handle's a little bit easier. But some of these little practical suggestions are really relevant things. And you know, one of the other pillars is technology. You know, one of the things I was a little surprised to see is like the lack of broadband internet in certain northern parts of New York and certain southern parts of New York. That's interesting to me because when you think about broadband internet, we use that for entertainment, communication, commerce. We use broadband internet for healthcare now too. You know, so when you think about identifying problems like that, it begs the question, where do you find solutions, you know? And that's what's in the pillars, is all these different proposals that can address it. I just gave 2 pillars, but Greg, there's more.
Yeah, and I think the pillars are really a way to organize the content. And I just want to be really clear that our job was not to edit and to decide what goes into the master plan, the 100+ proposals. But it's really organizational, because older adults touch every single system, to the commissioner's point. So you have things like workforce, long-term care financing, housing, transportation, technology. So that was really a way to organize a variety of different proposals that came in. So it was kind of made some sense.
And one of the pillars that I personally thought was most interesting was social engagement for older adults. I think that seems to be super pivotal when we're talking about quality of life and also just, mental well-being for our aging population. So were there any themes as you were going through the proposals that you saw relating to?
There's lots, and you're absolutely right. And we spend a lot of time, not only in the State Office for Aging, but in the health department and in the community, in combating loneliness and isolation. What we found from studies that were published in 2018 is it costs Medicare $7.2 billion to treat somebody who's actually lonely and isolated. It's equivalent to smoking almost a pack of cigarettes a day. So this is where all this fits in together. The technology is a critical tool to combat social isolation. So is building up a community, getting people to events using transportation. You can build these types of things into the housing plan. So, it's really important not to think of these proposals as, well, there's 100+, but they're each individual. They all cross-integrate in a lot of different ways because we all touch different systems. And the more that we can leverage connecting the dots, so to speak, the better we're going to be, because we're going to be helping people holistically.
I noticed that part of the plan also talked about the need for innovative financial models in terms of, putting these plans into action. So as you mentioned, we're seeing cuts coming down from the federal level that are definitely impacting New York. So what does that mean for the proposals and the way that they're going to be implemented?
Yeah, so, the reconciliation bill, HR 1, I read all 870 pages of it. It may sound a little odd, but that's kind of how I learn, right? But there's a lot in there that should concern everybody. One of my concerns was just how there's going to be people who are going to lose health insurance. Now, the governor asked us as the cabinet to see what we can do to mitigate those. So we're thinking of ideas of how we can do things to mitigate the impact of HR 1. What's interesting, though, is where you see the money in HR 1 invested, right? A lot of money invested in defense, a lot of money invested in immigration enforcement. Where you don't see investment, though, from the federal government is improving our health and well-being, or really helping people who are older adults, which should bother people. It should bother people more than it does right now.
Yeah, and I think, for us, our job, again, was to facilitate a process. There's the next step, which is, we have to figure out, in addition to HR 1, we have the appropriations bills in Congress that need to be passed by September 31st, right? And that funds all of our different agencies so that we know what we're dealing with. And then, a lot of these proposals, some of them can be done administratively. Some of them are going to need investments. Some of them are going to need statutory and regulatory changes. But that's where the governor, the legislature, we still have a council of state agencies and others will help. So we've gotten past the first hurdle, and I mean that in a positive way, which is we delivered the plan, the governor released the plan, and now it goes through the normal legislative process.
And what was the response that you both have received from New Yorkers, across the state when it comes to the releasing of this plan?
Yeah, so it's been great to hear what people are thinking about it. Like, one of the things about the Master Plan for Aging, because it was put together by so many different people, it's a little bit like the school play, because of all the kids in the play, people go to it, right? But when you have all these people involved in creating it, people are interested in it, right? And we're the 11th state to have a Master Plan for Aging, but because so many people had their hands in creating it, you see there's interest in this, and people are looking at their ideas. And the nice thing about ideas is ideas generate other ideas, right? So it's not like the work of the Master Plan for Aging was a be-all, end-all. The Master Plan for Aging Council still exists, but it's really one of those things where now that we have a plan, we'll see which initiatives go forward as legislation, but it points us in a direction. Like, as a health department, it points us in a direction about where we should be headed, because what we're trying to do is make it so New York State can age in New York, right? Now, home care is a big component of that. So one of the things that we've been focusing on in New York State is how do we make home care accessible, reliable, and affordable for everybody. But you see also in the Master Plan for Aging a recognition that there's informal caregiving. Like, as we get older in New York, a lot of people were going to require informal caregiving. In other words, someone to check on them, help them with the activities of daily living, just things around the house. That also helps deal with the isolation, by the way.
And lastly, beyond the master plan for aging, how are you hoping the state will continue to support aging New Yorkers in the years to come?
You know, for me, it's the math, right? We know that prevention is really important. That's a part of one of the pillars. And the health department just released the prevention agenda. That fits into this. We have a health across all policies approach, which simply means that other agencies, you may not think of yourself as serving an older adult, but if you're housing, if you're transportation, if you're parks and rec, we all are doing that. I think that we know that 70% of all healthcare spending has nothing to do with your health diagnosis or genetics. It has to do with the environment you come from, the personal choices that you make. So I think rebalancing so that we really have a seamless system where we can help people at the time that they may or may not need help earlier before they, wind up getting sicker or more frail, where they wind up in the most expensive places. To balance those couple of things out, that's where I hope not only New York policy goes, but national policy, because I think we all have a very long track record of working together in the community for good outcomes, and I think that's where I'd like to see things go.
I think just to pick up on the prevention agenda, it's the State Health Improvement Plan. But really what the State Health Improvement Plan is, it dovetails and really partners nicely with Master Plan for Aging. That was created by local health departments, hospitals, hundreds of community-based organizations, sometimes the same ones. But it's just a catalog of evidence-based public health strategies to help us keep populations healthy. Population health is intentional. Like, in other words, you don't get your population to be healthier unless you're intentionally driving that direction. Well, I think it's a wonderful contrast between where New York State is going and where the federal government is going. We're heading in a direction to intentionally make the population healthy, and we're supporting them wherever we can. By the way, there's a lot of risk out there, right? The climate changed, for example. It's hotter. Everyone's noticed it. But one of the things we need to look at is, how do we get more air conditioning, for example, in upstate New York? When I looked at heat injuries in upstate New York, a little more so than even in the city, which surprised me this year. It doesn't mean I have an air conditioner for everybody, but now that I see the data, how do we think together, or how do we solve that problem of how do we help people get more air conditioning? Just simple things. And sometimes it's not the state finding money for you, it's making other things possible so it can happen. Sometimes it's just building up the economy so more people can work longer. Because one of the things we saw in the Master Plan for Aging, by the way, is older adults don't mind working. A lot of them plan on working until they're 70 years old. And so we don't want to get in the way of that.
Well, it sounds like there's a lot of important work ahead. Unfortunately, that is all the time we have for today. But thank you both so much for taking the time to speak with us.
Thank you.
Oh, it's a pleasure. Thanks for having us.
And we were speaking with Dr. James McDonald, Commissioner for the New York State Health Department, and Greg Olsen, Acting Director for the State Office for Aging. For months, the state has been in the process of moving Medicaid consumers enrolled in the Consumer-Directed Personal Assistance Program to one fiscal intermediary. That company is Public Partnerships LLC, also known as PPL. But the transition has been far from seamless and ripe with controversy. On Thursday, the state legislature held a public hearing to examine the issues with the transition. At the hearing, the health department, along with PPL, were met with intense questions and testimony from state lawmakers. In this next segment, our Elise Kline gives a deep dive on the issues with the transition and how it's impacted New Yorkers enrolled in the program.
The state's fiscal year 2025 budget required New Yorkers enrolled in the Consumer-Directed Personal Assistance Program, or CDPAP, to use one fiscal intermediary. Previously, there were more than 700 fiscal intermediaries, or middlemen, who handled administrative tasks for the Medicaid program, like benefits and payroll. The move created great controversy, which has continued since the transition began in January. Initially, the biggest challenges during the transition were getting consumers and workers promptly onto Public Partnerships LLC, or PPL systems, the state's new fiscal intermediary. And through that process to get set up with care, many struggled to receive a prompt response from PPL about issues and challenges, an issue advocates say continues. Many advocates stress one of the biggest remaining issues is that workers are not being paid. Charles Hudson, a personal assistant for his mom, says they've been warning state leaders about these kinds of consequences.
For months now, we've been warning that PPL is failing New Yorkers in every way possible. Workers are going without paychecks. Consumers are losing the care that they depend on to live, and PPL systems continue to break down left and right.
Personal assistant Lolly Ettinger says while she's been fortunate not to receive too many inaccurate paychecks, people she works with have not been paid correctly at all.
New Yorkers, we need accountability, and we're not going to get it from PPL's leaders. It's been pretty obvious. This is the end of July already.
PPL currently faces a class action lawsuit alleging wage theft against thousands of CDPAP employees. Richard Blum, an attorney with the Legal Aid Society, says the job is demanding and challenging enough for workers, and they shouldn't have to worry about whether or not their paycheck will be on time and the correct amount.
And so for them, they need for the fiscal intermediary to do its job smoothly. So that's a host of things they just don't have to worry about. And instead, what's happened is PPL has made their lives incredibly more difficult and incredibly more stressful.
The lawsuit alleges PPL is in violation of the federal law, the Fair Labor Standards Act, and 2 state laws, the New York Labor Law and the Wage Parity Act. The lawsuit alleges that PPL has failed to fulfill its basic responsibilities, including failing to pay employees for a week's work, paying late or missing pay, failing to pay overtime and correct hourly rates, and more.
We were hearing dozens and dozens of complaints by personal assistants in the consumer-directed personal assistance program that they weren't getting paid. They weren't getting paid at all. They weren't getting paid very late. They weren't getting paid the right amounts. They weren't getting paid for all their time.
Blum says they heard from workers that the timesheet systems via an app, a phone system, a portal, and even paper timesheets were not working properly.
They weren't producing correct outcomes. The pay on the pay stub did not reflect what had been reported accurately.
Tabitha Haley, a consumer of CDPAP with muscular dystrophy, needs 24/7 care. She says since transitioning her assistants to PPL systems, she has had a host of challenges trying to manage their hours. Haley says she's had issues with the system allowing her assistants to clock in and out around the same time and accepting all the hours required for the 24/7 care she needs being immobilized.
1 week, the PPL said that I was over the hours, but that's impossible because I had 24/7 allocation. So how can you go over 24/7?
Haley adds prior fiscal intermediaries would assign a caseworker to help consumers manage all the details of personal home care, payroll, timesheets, etc. The consumer says without that help, it's caused her a lot of stress, which consequently impacts her well-being.
This has been detrimental to my health because, there have been tension at least, every other day, if not daily, with my PAs clocking in and out because what happens with PPL is they're taking some minutes away of your care for their own bank because they cannot manage, with their system.
Blum adds the Legal Aid Society also found violations of the Wage Parity Act that require both a cash minimum wage and additional supplemental benefit pay.
We also learned from the documents that PPL was sending out and from the pay stubs that they were allocating money that's supposed to be paid to the worker either in wages or benefits to benefits that seem pretty bogus to us.
The Legal Aid Society alleges in the lawsuit that PPL pays very little for benefits, overcharges workers, and keeps the balance, which violates the Wage Parity Act. A PPL spokesperson said in a statement sent to WMHT that they cannot discuss ongoing litigation, but that they are committed to paying personal assistants accurately and on time. They said they have processed up to date $2 billion in payroll to more than 230,000 personal assistants. PPL also said consumers should reach out to customer service if they have issues and that they have not received any formal complaints about 24/7 care and that the system, based on a recent survey, has achieved high satisfaction. However, consumers and workers stress response from PPL's teams to issues is frustrating and disappointing. Haley says she's tried multiple times to get in touch with someone from PPL and felt like they were just not listening to her concerns.
They cannot talk to you until they have a laptop open in front of them. They said, let me go get my laptop. And then they have to read what the laptop says. And they don't think. They're not like a coordinator in prior FIs that actually hear what you're saying, digest it, and think about whether that's right or wrong, and then investigate.
Blum says the first court conference on this case is planned for September. Lieutenant Governor Antonio Delgado says there should be an investigation into the accounting and payment process from PPL.
But we definitely need to be looking into all of the allegations that have been put forth around the irregularities when it comes to pays and mixes a full accounting of the wages that are being paid and or not being paid.
Some lawmakers say this lawsuit is an example of PPL's failings. State Senator Gustavo Rivera, a Democrat representing parts of the Bronx and the chair of the Health Committee, says there is a legal process that needs to play out, but the issue is part of a bigger failing.
It just shows that they were just not ready for prime time. This is the company that was made, that was chosen to take care of the transition, and it is my opinion, based on everything that I've seen so far, that they've done a terrible job of it.
Lawmakers across the aisle, like Assemblymember Brian Mayer, a Republican representing parts of Orange and Ulster counties, agree.
PPL just has not been able to do the things that were laid out for them to do in terms of the job that need to get done. It just has not happened. So we really should think about what we can do short-term and long-term to make this a better situation.
State Senator James Skoufis, a Democrat representing Orange County, also says lawmakers have a lot of questions.
In April, we saw that this was an acute problem where there were allegedly, many thousands of CDPAP employees who were not receiving payment. And not only do they want to look at why they weren't receiving payment, is it true they weren't receiving payment? How many, what was the scale of the non-payment? But why also was the Department of Labor not taking action during that time?
Blum says in his experience, the New York State Department of Labor hasn't been helpful when it comes to home care labor cases. He says the Legal Aid Society thought it would be more efficient to get justice to bring on a lawsuit versus going through the Department of Labor.
My experience with this New York State Department of Labor in the home care area is very discouraging. We actually are suing them right now for trying to close hundreds of cases of home care workers whose rights were violated under the labor law, and they have not wanted to pursue those cases. So, and they don't. That does not seem to be a useful avenue.
WMHT reached out to the Department of Labor, but they did not respond for comment. Skoufis says lawmakers are also looking into the process of how PPL was selected to be the state's single fiscal intermediary.
There are allegations, there are active lawsuits that relate to alleged impropriety, bid rigging associated with this award. And, I think everyone wants to have the highest level of confidence possible that this award was hopefully given out in a straightforward, legal, and ethical manner. And we're going to be digging into whether that was indeed the case.
According to the Department of Health, PPL was selected through a standard procurement process. While many lawmakers seem to be together in a bipartisan way on their stance against the CDPAP transition, some lawmakers welcome it. Assemblymember John McDonald, a Democrat representing parts of the Capital Region, says he feels strongly that this was a good move for the state and challenges were to be expected.
And the state is actually doing what it's supposed to do. It's overseeing the public funds and making sure that individuals still have the right to live at home and choose their caregiver, which is what the program was intended to do. I just unfortunately think it strayed from its purpose because a lot of corporations got in on this and realized this was a huge, quick money-making opportunity.
Other lawmakers like State Senator Jake Ashby, a Republican representing Rensselaer County, argue the opposite, saying that a third-party company isn't an effective way to manage a state Medicaid program.
I come back to over and over again, why can't government do this? Why are we so interested in putting this off to a third party rather than the actual auspices of the state government who are charged with handling this do the job?
A significant portion of the criticism during this transition process and its ongoing challenges has fallen on executive leadership. While Governor Kathy Hochul has stood by this transition and said publicly that they are working through the, quote, hiccups, advocates are frustrated and demanding action. Alana Berger, the political director of Caring Majority Rising, says the governor needs to act immediately.
These are not hiccups. These are systemic failures, and real New Yorkers are paying the price.
In a statement sent to WMHT, a spokesperson for the governor said Governor Hochul remains committed to protecting home care consumers and workers. The spokesperson added that's why she saved CDPAP from a fiscal crisis, removing wasteful administrative middlemen. Lieutenant Governor Delgado says he wasn't included in the decision-making process of the CDPAP transition. He says he hears from constituents being impacted negatively and felt he needed to speak out.
it became clear to me that I had to do what was right for New York, leverage the position that I am in as Lieutenant Governor to elevate these voices. Because no, I wasn't a part of the decision-making process, and I feel like I have a responsibility in this moment.
Delgado attended a rally last month and spoke to advocates about their frustrations. At that rally, advocates said what they want to see is an end to PPL's contract. They chanted their frustrations outside PPL's headquarters, hoping state leaders will hear them.
Governor Hochul, can't you see? PPL don't care about me. Governor Hochul, can't you see? PPL don't care about me.
Some state lawmakers also feel the governor needs to step up.
So this is on the governor's office. They need to take accountability, and we need to fix it.
Senator Ashby says he hopes to see state leaders recognize the need for a more thoughtful approach to managing and tackling the issues with the transition.
I think that the departments and especially the governor should recognize this and take a stronger stance and show some leadership and some backbone here.
State senators just held an investigative hearing this week looking into the CDPAP transition and its challenges. So it's possible we could see state lawmakers take actions into their own hands to address these issues. But at this point, it's unclear. Elise Kline, New York Now.
Well, that does it for this edition of New York Now. Thank you for tuning in, and see you next week.
Funding for New York Now is provided by WNET,